the ER can't fix this type of pain. And before anybody gets mad, I'm not saying don't go to the ER for an actual emergency. If you have serious trauma, you know, things like that, then yes. However, what most people with like chronic sciatica or herniated disc, bulging disc, stenosis, recurring low back pain, uh, they already, we already know what's going to happen. You sit there for hours, they make sure you're not dying. Maybe they give you some form of medication or an injection, and then they send you home with $1,000 ER bill, right? And that's because the ER's job is emergency stabilization, not long term correction, which 90 plus percent of the time, back pain, sciatica falls under this category, and this is how you correct it. That's why so many people, um, they go to the ER, they get maybe a temporary relief, but the pain, or no relief at all, but the pain always comes back, and it's just a repeated cycle. Especially when this comes from disc pressure, nerve irritation, loss of spinal movement, chronic inflammation, things like this. A lot of people don't need a temporary patch, right? Most people need a long-term fix. um, they need someone who would take the time to figure out why this keeps happening. And that's the difference in getting corrective care, where you truly fix the problem and it doesn't keep coming back on repeat. If you or a loved one needs help with back pain, sciatica, nerve related disc issues, herniated disc, bulging disc, you're told you need surgery, you don't want to do injections anymore, I'm Dr. G. I'm in Dallas. I would love to help you get your life back. Um, and I got your back for life.